Vermont GOP governor opens up COVID vaccines for those who identify as Black, Indigenous, or persons of color. Republican Governor Phil Scott tweeted about the move on Thursday. Well, I think I'm going to have to start identifying as Black, Indigenous, and a person of color, all three of those things, because it says right here, it only matters if you identify. Hello and welcome to The Ordeal. I challenge all things woke, so if you're new to my channel, this is what you're in for. Critical race theory is garbage. Vermont is opening up coronavirus vaccine eligibility to anyone over 16 years of age who identifies as Black, Indigenous, or a person of color, prompting fierce criticism online for excluding white people. This is illegal. You are not allowed to do this. It is against the 1964 Civil Rights Act. All right, Phil Scott, did you not understand that? I mean, you tweeted about the move on Thursday as states gradually opened eligibility to various populations. So far, the process has tended to focus on people who are vulnerable because of their occupation, age, or health status. Here's his tweet. If you or anyone in your household identifies as Black, Indigenous, or a person of color, BIPOC, including anyone with Abenaki or other First Nations heritage, all household members who are 16 years or older can sign up to get the vaccine. Get yours at this place right here. The state's website advertises BIPOC household-focused clinics in northern and southern Vermont. For the Burlington area, the state offers a vaccination form that specifies eligibility is for BIPOC individuals and members of their household. The first question asks, do you identify as Black, Indigenous, person of color? This includes anyone who is non-white. I'm not white, I'm like above and beyond all human races. So there, I've elevated myself. I am angel or something. There you go, that's my race. Other eligibility categories include people 50 years and older, people 16 years or older with high-risk health conditions, English language learners, and people in immigrant refugee communities, healthcare personnel and residents of long-term care facilities, people who work in the public safety system, and school staff and child care workers. The immigrant refugee category similarly offers community-specific clinics. The category's link to a site describes the state's strategy of working towards equity. Yeah, that's communism, working towards equity. It's equality of outcome, not equality of opportunity. I agree that there needs to be better equality of opportunity. I will wholeheartedly agree with you that there's not enough opportunity, not enough equal opportunity in the United States. We do a pretty good job, but we're not perfect about it. We need to be better. We still have much more to do to address the significant disparities in the rates of COVID-19 infection, hospitalization, and death among Vermonters who are Black, Indigenous, and people of color. Maybe the reason these people right here have higher rates of infection is because of their culture. Maybe they're suspicious of getting the vaccine. Maybe they're less likely to wear a mask. Maybe they're more likely to engage in interpersonal relationships with strangers. I don't know what else to say. I mean, there's lots of different reasons why they could be getting infected more often. The website reads, right now we are working with funded community partners to understand the barriers that might limit vaccine access to BIPOC Vermonters, as these require unique public health solutions. The site adds that it makes good public health sense to follow families and households facing language and access barriers to get information and services at the same time, rather than duplicate these services later on. No, I'm sorry. Your language barrier doesn't mean anything to me. If you have a language barrier, hire a translator. Otherwise, stay in a country where your language is the dominant language. That's it. The initiative faced a wave of backlash online, wildly unconstitutional and absurdly unethical. Conservative commentator Matt Walsh tweeted, and he's a Republican, of course. This is critical race theory. Discovery Institute researcher Chris Ruffo said, referring to the controversial and now widespread school of thought that often includes generalizations about particular races. Earlier this week, Ruffo announced an article in which two Harvard physicians proposed racial preferences in medical care as a moral crime. Yes, it is a moral crime. It is immoral. It is also illegal in the United States. So don't know what to tell you other than you can't do that. And I expect there's going to be lawsuits against Vermont. If I lived in Vermont, I would be talking to lawyers right now instead of making this video. In a statement to Fox News Friday, Ruffo called on public interest attorneys to file a lawsuit against Vermont. Vermont's program of racially separated standards, which denies medical services to specific racial groups, is flagrant violation of the 14th Amendment, he said. Let's see what the 14th Amendment is. A person born or naturalized in the United States and subject to jurisdiction thereof are citizens of the United States and of the state wherein they reside. No state shall make or enforce any law which shall abridge the privileges or immunities of citizens of the United States, nor shall the state deprive any person of life, liberty, or property without due process of the law. There you go. Back to the article. It follows the logic of critical race theory, which demands that society practice racial discrimination to rectify racial disparities, but is not compatible with American law. Sadly, Vermont is another example of state neo-racism that has gained in popularity in recent years. Public interest lawyers should immediately file suit against the governor. I would file a personal suit against him if I could. Vermont's move fits a pattern of state-backed initiatives focused on minorities. Fox News recently reported on Columbia University promoting graduation ceremonies based on race and other aspects of personal identity. The University of Nevada, Reno, is similarly offering living learning communities focused on race and ethnicity. Both have clarified, however, that these programs don't exclude white individuals. Okay then, define white individual to me. Localities are also pushing selective universal basic income based on race. Yeah, that's illegal and immoral. You can see right here, one California city is giving $500 a month to black families with low income. Yeah, so San Francisco Bay Area, City of Oakland, California, home to decades of civil rights activism, as well as huge tech-fueled disparities in wealth, laid out its plan on Tuesday to give families of color, that doesn't include white, well, they're spelling color with a U for some reason, Independent must be an English publication, $500 a month with no strings attached, one of the largest universal basic income pilots ever tried in the US. It's illegal and immoral, and if I were living in Oakland, I would file a lawsuit right now. It's very simple. Very, very simple. You're not allowed to discriminate on the basis of color. RUFO has been highlighting situations like these and started a coalition earlier this year designed to bring lawsuits with the aim of reaching the Supreme Court. Yep, all this stuff needs to go to the Supreme Court. It needs to be taken care of now. But it's not going to stop with the states. We can go after the states. That's pretty easy to do. They are beholden to the laws of the land. Everybody is beholden to the laws of the land, but companies can get away with certain things. Like, look at this right here. Wright State Medical Residents Pilot Anti-Racism Dialogue Training. A group of Dayton doctors early in their careers are piloting an anti-racism dialogue training never before applied to the field of medicine. The program offered to the Wright State University OBGYN residents for the past year will soon be expanded to include Boonshoft School of Medicine Administration and eventually faculty, other medical residents, and students. The training facilitators hope the program expands beyond Wright State someday and helps as many doctors as possible grapple with their biases. Yeah. I wonder if these doctors if they're biased against white people, is that going to be something that they address? Because we all know that, it's not going to be addressed because BIPOCs, BIPs, as I like to call them, BIPs can't be biased against whites. It's not possible. It's fact. Like the most impossible thing in the entire universe, I think, right? I mean, it's like when you have a logical contradiction, like a married bachelor. There's no such thing as a married bachelor. That doesn't exist. Or a round square. Those things don't exist, right? It's the same thing with like BIPs being prejudiced or biased or racist against whites. It just doesn't happen. The Dayton Daily News Path Forward project investigates the most pressing issues facing our community, including race and equity. These are not pressing issues. This is a distraction from real issues like, child trafficking. How about we deal with the homeless problem in the United States, the disabled veterans problem in the United States? Those seem like they're maybe important things we could be putting our money and our focus into. Those are things that we could actually focus on and resolve if we did focus on them. But you don't want to do that. You want to focus on this other stuff that doesn't matter at all and make it something that does matter. But the only thing we could do is just ignore it. It's already been handled. We already have laws against this stuff. Don't worry about it. Move on. Black and minority people in the Miami Valley and the country have poor health outcomes on average, including higher rates of maternal and infant mortality and shorter life expectancies. The racist biases, unintentional and intentional among healthcare professionals, likely contribute to that. The long-term goal of this training is to create more equitable treatment and outcomes for patients, said Dr. David chair of the Department of Obstetrics and Gynecology at the If we create a group of doctors who have the ability to listen and to relate, to build trust and relationships, I truly believe that's what the answer is, he said. This is the first step of a 1,000-mile journey. No, you are freaking so wrong. You are so freaking wrong. Do you think that maybe these BIPs are dying at a higher rate or get poorer health care because they don't have the money that the average white person has? But on average, they earn less money. They earn less money. They are not being restricted in their ability to earn less money, but they restrict themselves due to their culture. Because you know what? My office mate is black. My boss is black. His boss my boss's boss is a woman, okay? There is no restriction in the United States on these people. They can do whatever they want to do. So don't even start this garbage with me, because I've seen it too much in my life. This David person said this training goes beyond checking a box. Yeah, okay. Dr. Keith Kindle, I'll call him just Keith Kindle, instituted the dialogue sessions when he took over as the assistant OBGYN residency program director this past academic year. Once a month for the past 8 months, he and Dr. Tasha, whatever, a pediatrician from Cincinnati, have facilitated dialogue sessions lasting 1 to 2 hours using a method developed by the University of Michigan. The residents are not required to come, but all 24 of them have attended at least one session, Kindle said. It speaks volumes. They keep investing their limited free time in this initiative, he said. It speaks not only to the need, but the desire to be better, the desire to be more informed, to be more participatory in the care that they give patients. I'm going to go out on a limb here, and I'm going to guess why these people are attending these things. Because we've been brainwashed our entire lives to believe that white people are evil and that we as a society, treat BIPs as less than.
He teaches us that the black man by nature is divine. Now, does this mean that the white man by nature is evil? By nature, he is other than divine. Well, now, does this mean that he's evil? Can he do good? By nature, he is evil.
Inherently, we do this. No. That is not at all even a little bit true. I mean, maybe there are some instances of this, but overall, it's not happening that way. That's not how it washes out. I treat all of my students, no matter what they look like, get treated the same way. I don't discriminate against them at all. I look at the work before me and I go, this person deserves this grade. That's it. There's no discrimination there at all. Okay? Now, we've also been told that men are evil. All this time, men are the evil perpetrators of all the evilness in the world. Men and whites. There you go. So white men are the worst. And this is ingrained into us. I mean, I was told this repeatedly. I thought that I had to be a certain way. I had to be different than who I was because women kept telling me, society kept telling me, you're bad, you're wrong. Somehow there's something wrong with you because you're a white man. You got to change. You got to be different because you're a man. You got to be different somehow. I never bought in for a second that I was wrong or bad because I'm white. I never bought that. But I did buy into the whole, I'm bad, I'm wrong somehow because I'm male. I got to be different. I got to do what women say they want. And so I did all that, and guess where it got me? Into trouble. Imagine that. During these sessions, participants dig deep into their own experiences with race and other identities, such as disability, gender, sexual orientation, often through discussion and initiative puzzles. What? Okay then. Disability. They're doctors. How do they have a problem with disability? Their whole life, pretty much. I mean, most of these doctors, they make a living off of people with disabilities. It's really not telling people how to be. It's really just challenging people in a safe way to really learn about multiple social identities and how that can apply to not only medicine, but really just living life. No, I really think that we have to kind of open our eyes to everyday experiences before providers themselves can really identify the biases in healthcare. No, I've already explained the biases in healthcare. It's very, very simple. And I want to say this, women's complaints aren't taken seriously. Well, that's because women over-exaggerate. If you've ever been to the doctor and you have pain and they give you a pain scale and you go, yeah, I'm a 5 or whatever. What my experience has been, because I've been to a lot of doctors, a lot of healthcare providers, because I was born with health issues, all right? That's how it is. Some people are born healthy, I was not. People are like in just a little bit of pain and they'll be like, oh, it's a 9, it's a 9, it's so bad, it's so terrible. And usually it's women complaining about that, not men, from what I've seen. Men will be like, oh yeah, it hurts a little bit, I don't know, it's a 3 something. And it could be something like debilitating, and then they're like, yeah, it's a 3. Whereas the women are like, they got hardly anything wrong with them, and it's the worst pain ever. So, Dr. Zachary Candela, a third-year OBGYN resident, said the program has taught him a lot about how to be mindful of a patient's background. It's just really given me a lot of perspective on how to engage with patients that may not look like myself, said Candel, who is white. You should treat them with kid gloves because, that's how they need to be treated. They can't take care of themselves. Dr. Kindle said this is not implicit bias training. Yes, it is. Yes, everything you've said up to this point it's implicit bias training. How is this? These people. In medicine, we often act like if you check a box and take one training session, then you're no longer racist. You're automatically an ally, and you get it, he said. But our biases, as white people in particular, always exist with us and we cannot get rid of them. So it's more important to me that people understand that they exist and they can't go away, and how to navigate them in the world is the skill that dialogue provides, not removing them per se. Wright State University Boonshoft School of Medicine Administration is committed to expanding the program, starting with top leadership in the fall, said Dr. Albert Painter, Assistant Dean for Faculty Affairs. The school has really had a long-term commitment to diversity, equity, and inclusion, and we just want to take it one step further, he said. The school is very excited about this initiative. Before the training can be rolled out to all faculty and students, more facilitators must be trained, and some details need to be decided on, Painter said. Dr. Kindle and the others have met with Painter and Verali Weber, Dean of the Boonshoft School of Medicine. I like how, okay, so this doctor here is a female, I'm assuming that's why there's a hyphenated name. This, I don't know, what is that, some Middle Eastern language, and this one here also, maybe Indian? So these people aren't even white, and they're probably immigrants to the country, and they think they know how this country needs to be run, even though they haven't lived here their whole lives. And they've seen in their own countries how bad it can be, but yet they want to ruin this country here. So what I've said about mass immigration many times. Earlier this year, Governor DeWine declared racism is a public health crisis, Weber said in an email statement. Health inequities and disparities have long been a concern of those of us in medical education. Okay, so this is going to be a problem for me because this is going to be coming to a head here next few decades, and I'm getting older, and I'm going to be needing healthcare. They're not going to treat me because I'm white. We have other problems here too. Exclusive Cigna critical race theory training. Don't say brown bag lunch, and be mindful of religious privilege. There's no such thing as religious privilege, okay? I'll tell you that right now. Why don't all Christians in the United States go hang out in Muslim countries and like proselytize Christianity to them? See how far that gets them. I'm an atheist. You're allowed to believe whatever you want to believe in the United States. That's one of the beautiful things about this country. Everybody's allowed to be wrong. Because, you know, we can't all be right. Even if okay, let's say that assume there is a deity of some sort. Is it Allah? Is it Jesus? Is it Yahweh? Is it Krishna? Is it Vishnu? Who is the deity? Who is that person? There's different religions out there that say it's a different person, so they can't all be right. So religious privilege, huh? Let's see what that's all about. Employees at one of the nation's largest health insurance providers are routinely subjected to far-left critical race theory lessons and asked not to consider white men in hiring decisions, according to leaked documents and chat logs obtained by the Washington Examiner. So I'm stuck. Fortunately, I have a job. I'm stuck at that job. I'm stuck there. I'm going to have to start identifying as some sort of different race, because if I want to get a different job, they're never going to hire me, which is ridiculous. So my industry, the animation industry, hires a lot of foreigners. So people will come in from other countries to work in the United States. So they don't even have to worry about. I was like, fine, we'll just get somebody from a foreign country. It's fine, no big deal. So we'll start advertising in other countries. If we can't find somebody here that is a different race, this is racist. This is illegal. You cannot discriminate against white men. It's illegal. And if I found out that a company was discriminating against me because of my race or my gender, you go to the EEOC. It's very, very straightforward. You just go to the EEOC, say, hey, look, I'm being discriminated against. All of the books are thrown open, and you get a settlement if it does, show. Everything is just examined. And if it shows that you're being discriminated against based on your race or your gender, you get back pay, you get settlements, there's fines. It's pretty straightforward. Those who work at Cigna told the Washington Examiner that they are expected to undergo sensitivity training they consider racist and discriminatory. Yeah, they should. Lessons include reviews of concepts such as white privilege, not a thing, gender privilege, not a thing, well, it is for women, and something called religious privilege, which is described as a set of advantages that benefits believers of a certain religion, but not people who practice other religions or no religions at all. Employees say they are pressured to comply with inclusive language outlines that suggest replacing terms like brown bag lunch with lunch and learn, or grab and go. It's brown bag, okay? It's a brown bag lunch. What the hell? You can't call something by the color that it is because, we refer to some human beings as that color. That's wrong. Oh. So what if I say that's a brown dog? And that dog is actually brown. I'm not allowed to say that. There's a reason why it's called brown bag lunch. It's in a brown bag. What the hell's wrong with you? Let's see. Here's the term or phrase, and here's the inclusive term phrase. Grandfathered. A continuation of a legacy. No, it's called grandfathered. All right? Brown bag lunch. You already saw that one. Hey, guys. Hey, team, friends, you, ally, y'all, people. You all. So I could just say, hey, you, because you can be plural. Hey, how's it going, everybody? Everybody's here? What's up? Because it doesn't really matter. Guys is not considered gendered, but I consider it gendered. And so I'm not comfortable saying, hey guys, when I'm referring to women. But, that's up to the women to go. I've heard women call other women guys. You're so articulate. Good job. Oh, yeah. No, if somebody is articulate, I'm going to call them articulate. Doesn't matter who they are. Wives, husbands, boyfriends, and girlfriends, spouse or partner. Why is this offensive? Really? What is this? Mothering or fathering, parenting. Okay. Going into this blind. Why is it? Because that's offensive to blind people? Oh my, going in unaware or not knowing what to expect. I had a crazy day because crazy people are a protected class, apparently. I had a busy, stressed day, whatever. Man hours, work hours, staff hours. Mankind, humanity. Man is an abbreviation for woman. I'm not saying that we should continue to use it that way, but that is what the word man refers to. It's an abbreviation for woman. I think that was a term as well, long time ago, for man. It was longer than just man. It was like lawman or something, layman, something like that. And it meant a male human, whereas a woman meant a female human. And then man, they shortened the abbreviation of that was man. Well, both of those was man. So we would say man to refer to human beings. China virus. No, Kung flu is the correct term. Kung flu. Quite in the peanut gallery. Peanuts are a protected class now, apparently. Off the reservation. Yup. Hey, wait, rogue? That is offensive to rogues. How dare you, sir? How dare you? That is offensive to rogues. Gypped or gypped? Ripped off, cheated. Yeah, okay. Gypped is fine. Master bedroom, master bathroom. Primary bed, no, master bathroom. Sorry, it's master. Long time no see. It's been a while. Is this offensive to blind people again? I don't. No can do. Why is this offensive? No can do. Hip hip hooray. Is this offensive to people who don't have hips? I don't understand this. Blacklist, whitelist. Yep. Nope. Blacklist and whitelist are perfectly good terms. You're too young to remember this, but no, you're too young. It's not. People understand aging, okay? There are people younger than me. There are people older than me. It's not. Other suggestions include avoiding the phrase no can do and replacing it with unavailable. Employees are told to avoid gendered descriptions of romantic partners or family members and not to use hip hip hooray at birthday parties so others feel included. How? Okay, microaggressions list include questions such as, do you even know what Facebook is? Well, if that's a legitimate question, maybe take out the even. That might be a little bit disrespectful, but do you know what Facebook is? It's fine. And are you a nurse? Okay, how is that? Employees are also asked to go through societal norms checklist and tick off boxes if they are white, Christian, or heterosexual. Of course they are, because, that would be outrageous to think that they could, those things, these are the worst things you can be, white, Christian, heterosexual, and male. They forgot to put male in there. Our inclusive culture at Cigna means that we're working hard to ensure everyone feels respected, welcome, and like they belong, wrote Susan Stith. Is that Stith? Susan Sith. She's a Sith Lord, I'm sure. The Cigna Foundation's Vice President for Diversity, Equity, Inclusion, and Corporate Responsibility in an international memo. This extends to the words we use, including understanding when certain terms might be perceived as negative or hurtful, and being intentional about choosing positive alternatives. I find this word right here, positive, highly offensive, sir. How dare you? How dare you use the word positive? That's offensive to me. The societal norms checklist: able-bodied, aged, Christian, cis male, heterosexual, upper class, white. Okay, so I don't check all of these boxes, but I do check some of them. It doesn't really matter though, because white privilege is a myth. Cigna valued in the tens of billions, boasts over 73,000 employees in offices worldwide. A 2020 Fortune 500 ranking placed the corporation at number 13 largest in the country as measured by revenue. The company recommends employees learn more about racism by reading controversial books such as White Fragility by Robert D'Angelo. That would teach you how to be racist, and How to Be an Anti-Racist by Max Candy, of course. The book list also includes 2 works by accused left-wing terrorist Angela Davis, Policing the Black Man, and Are Prisons Obsolete? Davis was arrested in 1970, kidnapping and murder charges following a deadly attack on the Marin County Civic Center. Well, did Davis actually commit those acts? And I should read these books. I wanted to read White Fragility. I just haven't had time to sit down and do that. There's been so much going on. And go through that and pick it apart for you all to see, but I haven't gotten to that yet. We'll hopefully get to that soon. The lessons learned from the sensitivity training seminars some employees allege have even extended to the hiring process. Thousands of companies openly consider diversity when giving promotions or hiring new talent, but Cigna practices go a step further, one employee alleges. Okay, so books, there's all these different books. That's cool. You should read those books, yeah. So you can become more evil. Yeah, I'm not going to read through the rest of this. It's been a long article or a long video as it is. I have to use this crappy insurance too, by the way, and it is crap. I mean, people are always, oh, you have such good insurance. No, I don't. The copay is outrageous, and it's a long time before they start to fully cover everything. Unfortunately, I'm stuck using them because I have to have health insurance, and this is the company that my company provides for me. And getting the Obamacare is not going to give me what I need. It doesn't cover enough different stuff, the kinds of things that I need. So yeah. So it doesn't matter if this is a state doing this or not. The state can do this. Up here, this is not going to change anything because we have these private companies doing the same thing. These other institutions that are pushing this critical race theory onto us and telling us, reminding us persistently that white people are evil. White people are the root of all the world's problems, don't you know? Anyway, thank you for watching. I do really appreciate everybody stopping by. Please like, comment, share, and subscribe. I will see you next time.